Do your hips pop a lot? Do they snap and pop every time you're at the gym and maybe you do a mountain climb or a leg lift? Are you worried about it and think something's wrong with your hip joint? If so, this video is going to be great for you. Hey, I'm Dr. Putney from Wellington Family Chiropractic, and today I want to talk about what makes hips pop. So this happens a lot in clinic. I'll have patients that come in. A lot of times they're low back patients, or maybe they have some pain around the hip. And when I've got them lying on the exam table and they're on their back, they'll bring their hip up and they'll tell me, every time I bring that hip down, it pops every time. And they'll show me again and again and again. They bring their hip down or they straighten their leg out and they get a clunk right at the front of their hip, and it feels like it's in their hip socket. Sometimes they feel like it's happening in their low back. What causes that? They always ask, is there something wrong with my hip? So what I'm going to do today is just explain the phenomenon and how that happens, and show you that it may not be something necessarily to worry about, but it does show you might have some things to work on. So the culprit is typically not the hip joint itself. It's a group of muscles, or a muscle grouping called the iliopsoas. So what's the iliopsoas? It's two muscles that come together. They're both hip flexors, so that's why they shorten whenever you flex your hip. In other words, you bring your hip up, you're sitting in a chair, your hip is flexed. Those muscles shorten to bring the hip into flexion. The psoas muscle runs from a vertebra T12 to L4 along the side of the vertebra, and it comes down inside the pelvis, excuse my bad art, and then it actually travels all the way through, and then this would be your hip joint here, and there's a bony projection off the inside of your femur there that the psoas connects into, and then you have the iliacus along the side of the inside of the pelvis that runs right down. And so you have muscles that run past the sacrum inside the pelvis down to the femur, the big bone in the top of your leg. And the popping or that thunking that you're feeling is happening somewhere right in here. And you may wonder, well, why does that happen? So what happens for those people is typically they are not controlling the position of their lower back very well as they're moving their hip. So they can't move their hip independently of their low back. And what I mean by that is we have our person here laying on their back. So let's say you're doing some sort of exercise where you're flat on your back. Let's say like a dead bug is what we do in our office. And they'll be in this position. The hip is flexed, the knee is bent, and they're just going to lower the leg down. If you're doing it well, the low back is going to stay fixed in a neutral position. Okay? What we see in these people is if they get that thunk, a lot of times their lower back will arch excessively as the leg is moving down. So as this is going down, the low back arches up, and we get a contraction or a tightening of these muscles over this little bony projection at the bottom of the pelvis, and you get a thunk where it crosses over onto the femur. So as soon as this pulls down, this is short, you get a thunk right there as the leg's going down, and you can do it repetitively over and over. The problem with this excessive arch is, or what that tells us, is that you're not really using the muscles that are meant to stabilize your low back properly. So the best way to stabilize your low back and keep it neutral is to create intra-abdominal pressure. A lot of people can't do that and maintain a neutral spine. So as soon as we lose that intra-abdominal pressure, we're not using the muscles in 360 degrees around our trunk, our erectors on the back, but specifically also the psoas will take over. So you're using the iliopsoas as compensation, and it's so short and tight that it cranks back forward, and as you extend the hip, you get that clunk. So what does it mean you need to do? You need to work on things that are going to help you control the position of your spine. So if you're laying flat on your back, you should be able to keep your low back flat against the floor, close to it. You might lose a little bit of it as the leg goes down, and sometimes in clinic we can actually correct this on the table. They'll have the big clunk as their hip extends or the leg moves down, and as they're about to get to the clunk or after they've shown me the clunk a couple times, I will cue them by putting my hand on their low back, having them press their hand into my low back, or press their low back into my hand as they extend the hip, and the clunk goes away, because we've gotten the iliopsoas to relax as that motion is happening. So it's a motor control problem. And what do you need to work on? You need to work on coordination or motor control of your low back. I'm not going to go into all those exercises today. I think some of my favorite are the 3-month supine position by DNS. So DNS 3-month supine. Great exercise to work on this. The dead bug trains you how to move your hip up and down, keep your low back neutral, or not that excessive arch as your leg comes down. Those are great places to start. The other great thing is there's a ton of great videos on YouTube about intra-abdominal pressure. And if you're not familiar with that at all, I would suggest you search that on YouTube. Look up a video where they're explaining the process of, through breath and using the abdominal wall properly, you create a lot of pressure through your trunk, and that actually frees up the motion of the hip. You shouldn't have that clunking. Is it a long-term issue? Does it mean you're going to have hip pathology or degeneration in your hip? It doesn't mean that at all. Sometimes it's been shown to cause some problems. Rarely, maybe in the muscle or the tendons down here. But it's not a huge thing to worry about. It just shows that you probably have some motor control issues, something you need to work on, and your low back and your hip could move better. So if you have a hip that clunks every time you're doing these exercises, work on intra-abdominal pressure, and then begin to drill those DNS 3-month supine positions and things like a dead bug exercise. It's not hard to find those on the internet. They're not hard to do. They're a great place to start. I hope this answers this question for you guys, and we'll talk to you soon.